Welcome to today's Campus Grand Rounds, a day in a life of a climate change expert. My name is Nicole Dutra. I'm a senior project coordinator for the National Environmental Health Association, and I'll be your moderator today. To begin, I will review the learning objectives for today's seminar. I will provide a few brief announcements. I'll introduce our expert speaker who has a great presentation planned for all of you today. We will hold a short Q&A session after the speaker's presentation for any questions that you all may have. Then I will introduce our panelists who are going to share with you a day in their life working in climate change. Following that, we will hold the main discussion and Q&A session. And lastly, NEHA's Adrian Gothard will address all the students with an opportunity. Then I'll close out today's seminar with some final announcements. After attending this seminar, you will be able to explain the various roles and responsibilities of an environmental public health climate change expert, compare and contrast the responsibilities, challenges, and rewards of working in climate change, and assess whether a career in climate change aligns with your personal interests, skills, and professional goals. With that, allow me to cover a few housekeeping items before we get started. Please note that the seminar is being recorded. The recording will be uploaded onto NEHA's Environmental Public Health Campus Grand Rounds webpage. You could also find recordings for all of our previous seminars on that page as well. We'll drop the link for you in the chat in just a moment. Please utilize the Q&A option on the Zoom screen to submit any questions that you have for our speaker and panelists. You should see that option on your screen. At the conclusion of the seminar, you will receive a link to take part in an evaluation survey to provide feedback and comments on today's seminar. Now, for those of you that may not be familiar with NEHA, allow me to provide a brief overview of who we are. As an association, everything we do is to build, sustain, and empower the environmental public health workforce so they're equipped and prepared to protect the health of communities across the country. NEHA supports the environmental public health workforce by striving to provide the most up-to-date trainings, tools, and resources across the many fields considered environmental public health. NEHA supports building workforce capacity, efficiency, and effectiveness by focusing on increasing knowledge, skills, and competencies across all environmental public health fields. We also have a long-standing history in credentialing. For example, we have our Registered Environmental Health Specialist, or REHS credential, and our Certified Professional Food Safety, or CPFS credential, and there are others as well. Our credentials are evidenced through our testing and maintained through continuing education. So if you're not already a member, you should join us today. We'll drop a link for membership in the chat for you in just a moment. In addition, we host an annual educational conference and exhibition, which includes hundreds of sessions focused on all the different fields of environmental public health, like food safety, private water, on-site wastewater, vectors, climate, air quality, emergency preparedness, response, body art, and so many more. This year, we're hosting our AEC in Phoenix, Arizona on July 14th through the 17th. And this year's conference promises to be your oasis in the desert. Registration is open, and full conference rates include tickets for our exhibition grand opening and our networking event. Now, without further delay, allow me to introduce our guest speaker. So, Natasha DeJarnett is a PhD, MPH, BCS, is an assistant professor in the Christina Lee Brown Environome Institute at the University of Louisville, researching the health impacts of extreme heat exposure and environmental health disparities. She is also a professional lecturer at the George Washington University. Most recently, Dr. DeJarnett was the Deputy Director for Environmental Justice Data and Evaluation at the White House Council on Environmental Quality. There, she served in our nation's first ever Office of Environmental Justice at the Council on Environmental Quality, supporting the Biden-Harris administration and advancing the most ambitious environmental justice agenda in history. Previously, she held roles at the Environmental Health Association as well as the American Public Health Association. Her service leadership experience includes the U.S. Environmental Protection Agency's Children's Health Protection Advisory Committee, Citizens Climate Education, Physicians for Social Responsibility, the BTS Center, and the American Academy of Environmental Engineers and Scientists. So, Dr. DeJarnett, I would be happy to pass the floor over to you. So I will stop sharing my screen and you'll be able to share yours.
Well, thank you so much, Nicole, for your generous introduction.
Of course.
And I am sharing the screen. Give me just a moment to get things up and running. And again,
Perfect.
Thank you, Adrian. Thank you, Nicole. Thank you, Chris, and the whole NEHA family for the kind invitation to speak with you here today. And I have to say it's an honor to also be here with another NEHA staff alum, Madelyn Gustafson, who I worked with quite a bit here at NEHA on climate and health. And I'll be sharing about my experiences at the intersection of research and policy in climate and health. So just a little bit about my background. I was a biology and chemistry double major in undergrad. And from there, I worked in research and development at Lexmark International Incorporated, which is headquartered in Lexington, Kentucky. I went on to University of Louisville to pursue my master in public health here, where I concentrated in environmental and occupational health sciences. And then I also pursued my PhD here. And my dissertation research was around air pollution and cardiovascular health. And I also had postdoctoral training here as well. From there, I went to the American Public Health Association. I led the natural environment portfolio there, which included air, water, and climate change. And it was there at APHA where I found my passion in climate change and health. And I'll share a little bit about that in the coming slides. From there, I joined the staff at the National Environmental Health Association and supported strategic environmental health partnerships, as well as leading climate change and health at NEHA as well. While I was at NEHA, I began teaching at the George Washington University, teaching the biological foundations of public health, which is the intro into environmental health for master public health students there. I returned to University of Louisville as faculty, researching environmental health disparities, climate and health, and supporting meaningful community engagement. But for the last 2 years, I served in the White House Council on Environmental Quality and provided support to projects including the Justice 40 Initiative and the Climate and Economic Justice Screening Tool, which I will also describe in a little bit more detail here shortly. So in this talk, I'll share more with you about the ways research intersects with policy, including informing policy, building a movement, and policy implementation. Much of the work that I've done has informed policy. And by informed policy, I mean educating and communicating to different audiences about environmental health, namely about climate and health. And one of the ways that I've helped to inform policy has been by translating research. And one such example comes from the 2016 U.S. Climate and Health Assessment. So government agencies participated to write this report, and it's essentially a review of the latest science on climate and health, and it provided recommendations and guidance. So the American Public Health Association sat on a steering committee that was identifying ways to further disseminate the knowledge that was included in this report to make it more tangible to an outside audience, or a wider audience, I should say. And I should note that this report, it's very technical. It mainly speaks to researchers and practitioners. And so we needed to make the content even more accessible so that a wider audience can also become aware of the ways that climate change was affecting health. And so APHA worked with Climate Nexus to create this set of infographics. We wanted to make them attractive to the general public, including the language and the type of information shared. So There are 5 examples that I'll step through very quickly that are part of this set of infographics. So the first is on air quality. And so we took key facts that were included in this report and the latest science. And so one example is that up to 15% of increased mortality is associated with, or increased cardiovascular mortality is associated with increased exposure to fine particulate matter. There's also an infographic on extreme weather where we share that just over half of all waterborne disease outbreaks are preceded by a heavy rainfall event. We have another that is on rising temperatures, noting that rising temperatures are associated with increased respiratory and cardiovascular illness. And then one on vector-borne disease, showing that the incidence of Lyme disease doubled between 1991 and 2013. So we're trying to have the most compelling information, but have it in a visually appealing way so that it's very accessible to a wider audience. And then we had one overarching infographic that tied all of those topics together. And the best part about this was that APHA and Climate Nexus didn't create this resource just for themselves and their constituencies, but for it to be used and shared widely. And it has been. Other organizations have shared it, have connected it with their specific communications campaigns and digital toolkits, and I've even seen it in other published reports. And because there are multiple topics, people could choose one for their specialty or whatever main point they were trying to get across. So this is the most successful infographic campaign I have contributed to, and it's still being shared today. And even more excitingly, it's been updated since then. So I looked at APHA's website. What you're looking at is the old version, but there's actually a newer version with newer colors and newer information that's being shared. This set of infographics has really helped share and get out the word that climate change is a threat to human health. In terms of informing policy as scientists, we're really great at communicating with each other, but sometimes we're not as great at communicating with wider audiences. So I pride myself in being multilingual, not that I speak multiple different languages, but I speak a scientific language as well as I speak human very fluently. And so I participate in a number of podcasts and any types of opportunities where I can reach a wider audience to help get out the word that climate change is a threat to health. So my first podcast was episode 6 of Citizens Climate Radio. And on that episode, I gave a very long list of all the ways that climate change harms health and how that is connected to injustice and inequity. I have actually worked not to depress people quite as much since that first episode. And I'm really proud to say, as far as I know, I'm the most featured guest on Citizens Climate Radio. So in episode 47, I had the opportunity to actually instill hope. I was asked to paint a picture of what a healthier future looks like and was able to tap into a little bit more hope in that conversation. So I've branched from this into doing more video-based sharing as well, but all of this is really important to expand our reach to better inform policy. And also building a movement has been really critical to advancing policy as well. And during my time at the American Public Health Association, we hosted something that was called the Year of Climate Change in Health. And this was a set of initiatives that was built to enhance awareness that climate change is a threat to health and to drive action to protect health in our communities. And so each month took on a different theme. And each of these themed months had some activities that were consistent across each month and some activities that were highly specific and different for those different months. There was a ton of partnership engagement that was involved in making the Year of Climate Change and Health a success. I'm really excited that we were able to have 60 partners that signed on to support the Year of Climate Change and Health. Certainly a very strong social media push at that time. highlight of the year was a meeting that was co-hosted with Vice President Al Gore. And the climax of the year was APHA's annual meeting theme that year, which was themed Climate Change as Health. And so that was really the culmination of all of the events and the monthly themes leading to that point. And NEHA was involved, so I'm really excited to point that out as well. But this really helped to build a movement and to pull lots of people to see them space, whatever their different area of expertise was, in this space of climate change and health. Building a movement also means including the voices of those that are most affected and those that have often been rendered voiceless. So I had the amazing opportunity to be a presenter for the Schools for Climate Action, who arranged a youth advocacy summit on Capitol Hill to advocate to their legislative representatives that climate change action is needed to protect children. And so I was working at the National Environmental Health Association at the time of this, and these are images from that day. And I'm a little bit embarrassed to admit that in the second photo, I'm actually taking that photo from where I was sitting on the panel, because I looked into the audience and was so amazed to see a room full of children that were there to share their voices and raise their voices and have their voices activated about what was uniquely affecting them in their communities. And I've had the privilege and honor of working at the White House Council on Environmental Quality for the past 2 years, or the last 2 years, I should say. Some of that work of our team included the Justice 40 initiative. And in the Justice 40 initiative, President Biden and Vice President Harris set a goal to deliver 40% of the overall benefits of certain federal investments to disadvantaged communities that are overburdened by pollution and marginalized by underinvestment. And I'm really proud to say that overall, 71% of those benefits reach disadvantaged communities. And the Climate and Economic Justice Screening Tool was the tool that was used to identify disadvantaged communities. Certainly, tons of research informed the development of this tool, including a number of data sets that, again, took many years of research to inform and to develop. If you are looking for this tool is not currently available through the federal government. I welcome you to take a screenshot. There at the bottom of the screenshot of the Climate and Economic Justice Screening Tool is where that tool is currently housed, and you're able to access it and identify disadvantaged communities through this tool. And here at the University of Louisville, I'm really happy to highlight our Green Heart Louisville Research Project. Our answer to CBD prevention is the Green Heart Project, and it's supported by the National Institute of Environmental Health Sciences, along with the Nature Conservancy and many other partners, along with the community. And this study is a randomized controlled trial where trees are the intervention. So we are planting trees and shrubs and increasing greenness for healthier air. And so we examine health indicators and air quality levels before and after tree planting. Tree planting started in October of 2021. We have planted over 8,000 trees. And the Green Heart Study really provides an opportunity to establish roots as a healthier and greener neighborhood, and really can provide a green print for other communities to follow. So we definitely hope that this will be a study that can affect policy change in other communities that will benefit from increased urban and residential greenness. So with that, I think our partners, as you can see here in the white box list, many of the partners that collaborate for the Green Heart Study. And then I also highlight a number of people from the projects that I've mentioned from my day-to-day climate and health activities. I am happy to turn it back to our moderator and looking forward to any questions that may come later in this session. Thank you.
Wow, what a very successful career you have led. Very awesome, Natasha. We do have a question, and it's actually a question I was going to ask as well. As far as the infographics that you shared at the beginning of your presentation, is there a link available to be able to access those? or do they go to APHA's website?
Yes, please go to APHA's website and access the climate webpage. I believe it's apha.org/climate. If I find out otherwise, I'll put an update in the chat. Thanks for that question.
Great. Awesome. Thank you. So I have a question while we wait for any other questions from the audience. What recommendations could you make to students considering, like if everything you just shared, they're like, I want to do all that. How could they start out? What recommendations would you have for them?
Absolutely. I've been thinking on this myself. You've seen my background. I have degrees in chemistry and biology, and I do think that that has helped me to take and interpret, translate science very well. I don't necessarily think that is required. I think that what is most important is that you're resilient, because this field requires such. It requires creativity as well. It really requires enthusiasm. I think that if you have unique skills, that your skills and gifts will make space for you in this space. And we need all of the skills and all of the gifts in this climate and health space. So if you are excellent as a writer, if you're excellent as an orator, if you are excellent in engineering, I think there is space for you in climate and health. And I think that your skills and your talents are needed in climate and health. But having that enthusiasm as well as critical thought, I think will go very far in this field.
Wonderful. Thank you for that.
Thank you.
Any other questions from the audience for Dr. DeJarnett? All right, well, feel free to continue dropping questions in the box and we can address them during the discussion session. So I will bring up, let me share screen again. All right, please allow me to introduce our guest panelists for today. First, we have Madelyn Gustafson, who is a program manager in the Climate Crisis and Preparedness portfolio at the National Network of Public Health Institutes. Madelyn has experience managing programmatic work across public health, environmental health, and preparedness disciplines. She has expanded opportunities for the next generation of public health professionals by developing and maintaining internship programs in environmental health and through Public Health AmeriCorps. Through the Public Health Leadership and Education, Advancing Health Equity and Data Science program, she continues to explore the current workforce landscape to help break down barriers to recruitment and retaining the future public health workforce. She has experience in coordinating and managing environmental health working groups focused on climate, informatics, and preparedness with a constant interest in collaboration. At NNPHI, she is involved in the Environmental Health and Climate Work Group, a group that is driven by building capacity and shaping the role of public health institutes addressing climate change. Her creativity provides a unique problem-solving approach while remaining centered in program management and impact. Madelyn has a Bachelor of Science in Public Health from the University of Wisconsin-La Crosse with a continued focus and passion for environmental health. Next, we have Casey Neathway, who is the Director of Regional Health Emergency Management and Environmental Public Health Services at the First Nations Health Authority. He brings over 15 years of leadership experience in environmental public health and climate resilience across British Columbia, Canada. Casey currently serves as past president of the Canadian Institute of Public Health Inspectors and chairs the Americas Regional Group of the International Federation of Environmental Health. He is a recognized advocate for climate resilient health systems and has contributed to national and international efforts addressing planetary health, indigenous health equity, and emergency preparedness. And next, we have Cindy Haverkamp, who is a climate justice coordinator for the Tacoma-Pierce County Health Department in Washington State. In her role, she develops plans and policies to protect the community from the effects of climate change. Cindy graduated from Seattle University's School of Theology and Ministry in 2018 with a master's degree in transformational leadership. As a former public school teacher, she uses her background in humanities to help people understand and value their role in our beautiful and fragile ecosystem. She has also served as a parks planner for Pierce County Parks and as a board vice chair for two local environmental organizations, the Pierce Conservation District and the Chambers Clover Creek Watershed Council. In her free time, she hikes and camps everywhere as often as possible, sings in a local women's choir, and tries out new recipes using whatever her garden produces. So thank you all for being here. And allow me to stop sharing my screen. Hi. All right, now I can see y'all. All right, and so please, audience, if you have any questions, please go ahead and utilize the Q&A option to drop your questions in for any of our panelists or Dr. DeJarnett. And we are going to share stories of working in climate change. So Maddie, I will pass it over to you.
Yeah, that sounds great. Thank you so much, Nicole, and happy to give a backstory to really where I got here today. And I think you touched on a little bit of what I'm currently doing, but I started my public health, environmental health journey at the University of Wisconsin-La Crosse. I went to school for community health education, public health. And since I didn't have an environmental health degree option at my school, I guess I kind of curated my own by going to environmental studies classes and making that my minor. And within my undergrad, had the opportunity to do a preceptorship, so a semester-long opportunity to connect with a public health organization. And that's where I had connected with the National Environmental Health Association. And luckily, Dr. Natasha DeJarnett was willing to bring me in and had an incredible summer working alongside her and being mentored by her through that time. So that was really an incredibly important step in my career, and really she gave me the opportunities to network and really get my feet wet in environmental health to see is this something I want to do? And it absolutely was. So after the preceptorship, I continued my career at the National Environmental Health Association as a project coordinator and coordinated the climate and health, preparedness, and vector committees, as well as working on model aquatic health code projects, so a recreational water and pool program. And then also had an opportunity to work on the environmental health tracking project, so kind of a marriage of data science and environmental health. And now in my current role as a program manager at the National Network of Public Health Institutes, or NMPHI, I support our Public Health AmeriCorps program. I guess even further back, NMPHI has public health institutes across the country, and NMPHI's work is to support the public health institutes with resources and education and funding. So through this role, with the AmeriCorps program, we match recent graduates or interns to some of the public health institutes to do work there and on a more local level. But I'll probably speak more today in the climate space and environmental space about our environmental health and climate work group. So this work group is comprised of public health professionals working in or passionate about environmental health and climate. And my role really is to elevate and identify creative ways to lift up what the network is doing around climate, and really feature what they're doing in their communities. I'm from that national lens. I'm fully remote. I'm not in the community per se. So really important and fun to be able to have that opportunity to create those spaces for the public health institutes. I am totally a links person, so I'm going to drop a couple things in the chat for some examples. But last year at NMPHI's annual conference, we hosted a plenary panel with 4 different public health institutes featuring partnerships, policy, storytelling, and innovation, and really highlighting their strengths and in those spaces. So I just dropped that link in the chat if you want to take a peek at that. And we also have a storytelling map that I will share as well. But again, just trying to continue to find ways to lift up the voices of the public health institutes and the work that they're doing in their communities. But yeah, I'll pass it back to you, Nicole. That's a day in the life of Maddie.
Busy, busy, busy. Thank you, Maddie. And next, we'll go to Casey and learn about his day in the life.
Great, thanks so much. So yeah, my name is Casey Neathway, and I have the privilege of serving as the Director of Regional Health Emergency Management and Environmental Public Health in British Columbia, Canada. So I'm really thrilled to be here and share a bit about my professional journey and what I do and what kind of continues to inspire me. So my undergraduate education is actually in environmental microbiology. And then from there, I moved into working in silviculture forestry, which is the side of forestry that ensures that timber companies, so the logging companies, fulfill their responsibilities to regrow the forests that they cut down. So we have a bit of a unique forestry system in Canada that I won't get too deeply into, but essentially the lands are owned by the Crown, by the government, and then the timber companies have the obligation to return them to the way they were left. So seeing some of those land-based impacts and downstream, both metaphorically and literally downstream impacts of those land use activities really got me interested in that connection between the health of the land and the health of the people. Which then led me back to school to get my degree in environmental health, and then started my career off as an environmental health officer, where I was focused primarily on land use and community development, and kind of the impacts to community development on human health. After almost a decade kind of in that space, I had the opportunity to take on a leadership role in a First Nations or Indigenous community here in British Columbia, which really changed my perception and underscored for me the importance of Indigenous ways of knowing and a First Nations perspective on wellness. I'm an uninvited settler guest here on unceded traditional lands in British Columbia. And so learning from those original inhabitants of the people really created a different way of knowing for me on how climate impacts are leading to public health changes. My kind of academic journey has kind of continued throughout my career. I recently completed an MBA. I have a certificate in climate and health from the Yale School of Public Health, and I highly recommend that certificate program to anyone who's interested in this space. Yale does a fantastic job of kind of highlighting those linkages. And I get the opportunity to work internationally with groups, as you're seeing here today, and as was noted by Nicole in my work with the International Federation of Environmental Health. So my day-to-day work, I lead regional programs in health emergency management, environmental public health, and clinical operations, so nursing and primary care here within British Columbia. And my work really does focus on integrating those Indigenous knowledge systems and ways of knowing and culturally safe practices into public health service delivery. So a typical day can be anything from kind of strategic planning meetings and figuring out how we limit the impacts of anti-Indigenous racism that are so colonially embedded into our health systems here in Canada, to coordinating emergency responses with First Nations community leaders. In British Columbia, we are seeing an increasing frequency of climate-related emergencies, wildfires, floods, extreme heat events, We, in my region in British Columbia, had the hottest ever temperatures in Canada in 2021. And I know people usually think of Canada as not that hot, but we're talking 130 plus degrees Fahrenheit over a few extended days. So our work has really become more urgent and complex in seeing how the climate is impacting the health of the people. And climate health really does underscore kind of everything that we do in our public health programming. And that's because the health of land isn't just linked to physical health. And so it's not just kind of those wildfire smoke events or some of those more easily understood connections, but also thinking of the emotional and cultural and psychosocial health impacts to a changing landscape, to the original inhabitants of the land. There's really that aspect of grief and loss associated with climate change, the loss of traditional food sources or medicine sources, and really those changes to the territories that have been home to the Indigenous populations for tens of thousands of years. So we often find ourselves balancing those immediate response efforts when there are fires and floods and those kind of types of emergencies that lead to people evacuating from their homes, with a lot of long-term planning and ensuring that the communities we work with have the tools and training and culturally relevant supports they need to stay safe and help them keep their communities resilient. So it's quite a dynamic role, and we need to be adaptable and empathetic and have a really deep commitment to partnership and advancing the voices of those original inhabitants of the land who know best. As Nicole mentioned off the top, I am currently the past president of the Canadian Institute of Public Health Inspectors, which I would say would be the Canadian equivalent of NEHA, and have been in leadership roles for about 8 years with that group. And then I currently chair the Americas Regional Group of the International Federation of Environmental Health, which is kind of the regional body within the IFEH that's comprised of Canada, the United States through NEHA, Jamaica through the Jamaican Association of Public Health Inspectors, and then Haiti. Locally, I also sit on the board of the Okanagan Science and Discovery Society. So it's a kind of small science center here that really promotes education and science learning opportunities to youth. So I have a couple of small kids myself and want them to also be interested in this space, and hopefully they can also be thought leaders in making the world a little bit of a better public place. And then I've served on my municipality's Climate Action Advisory Committee, again, supporting local governments and elected leaders in putting some of these thoughts into practice to keep communities a little bit more resilient. And these types of kind of volunteer pieces both allow me to kind of stay connected globally to both the wonderful people and work that's happening outside of our own borders and boundaries, but also that within that grassroots community action, which I value very deeply. So my journey within this climate health space has really been about listening and learning from Indigenous voices and trying to lead with purpose to amplify those voices of the people who know the lands better than anybody, and making sure that my role in building health systems is effective, but also equitable and climate conscious and rooted in those Indigenous values. So I really want to thank NEHA for allowing me to share a little bit about my story, and yeah, looking forward to conversations ahead.
Thank you, Casey. I was going to say, you also hold the role of chair for NEHA's Climate Health Committee.
Do, yes, as well. So I chair the NEHA Climate Health Committee as well, which has given me some fantastic opportunities to meet and work alongside folks. We have some exciting webinars coming up in June and July, so stay tuned for those. And yeah, it's been really great to be a part of that work. Thanks for flagging that, Nicole.
Of course. Thanks, Casey. And next, we will hear from Cindy and a day in her life in climate change.
Thank you, Nicole, and thank you everyone else for being here today. I'm super proud and excited to be here with you. I represent a local county health department, so I work very much on the ground level. I'm out in community every single day doing all sorts of things. I got here in a very windy way. So when Dr. DeJarnett says that public health needs everyone, I'm an example of that. My background is in education. So I was a public school teacher for a very long time. And then I decided to switch to a degree in theology. I was hoping to become a pastor. And instead, I ended up taking some classes in environmental ethics and environmental ecology and theology. And I moved over into the public health world. And I'm very happy to be here. And I feel very lucky to be here because I don't have a science background. So everything I've learned since I've started my position about 3 years ago. Everything related to public health and science is kind of new to me, but it's great to be a lifelong learner, and I just want everyone to be encouraged that your background and where you think you might be ending up in your life is not necessarily where you will end up in your life, and that is totally fine. So I would say that one of the main reasons that I'm here in public health is that I have 2 daughters. They're in their 20s, and I would love for them to have a beautiful future. I'd love to have them have children of their own who grow up in a similar way that I grew up in the forests of Pennsylvania, enjoying the environment and having an environment to appreciate. So back in the 2000s, I saw the movie WALL-E. And that movie just scared me to death as a mom. I had 2 little girls by the hand and we walked out of the theater and I just didn't know how we were going to get them into a safe and beautiful future. So that was really the start of heading into this public health world. Now I work in an environmental health division called Social, Economic, and Environmental Conditions for Health. There I do develop plans and policies to improve the outcomes of vulnerable and frontline communities in responding to and adapting to climate change. Here we monitor and share risk communications for extreme temperatures, worsening storms, especially wind and flooding, and wildfire smoke. And as Casey mentioned, climate change and mental health is becoming a much more important part of my work as well. In my health department, we do have a special focus on certain populations. So we are especially concerned about children and youth, seniors, outdoor workers, incarcerated people, and those living unhoused. So I spend a lot of my time doing outreach on all of these different climate sensitive hazards to be sure the entire community has access to important information about their health. One really fun thing that we do is we give away a lot of box fan filters. We kind of share that a box fan filter has 2 important uses. It can be used when the weather is hot. In the Northwest, we're experiencing a lot more heat. And it can also be used during this wildfire smoke season to clean the air inside people's homes. So we are lucky enough to have a lot of these to give away, these kits. We give them away. We do some education around when to use them and how. We teach people about the air quality index, and we just focus those giveaways on those populations that I mentioned earlier. We do a lot of work with our local Department of Emergency Management and also, surprisingly, our conservation district. So our conservation district has a wildfire project manager that our health department helps to fund, and he and I do a lot of our outreach together. Last year, we attended 22 community events in our rural areas. So our county has, it has some cities. It has City of Tacoma, a couple other large cities, but we also have a very large rural population, and they have different needs and different concerns than the people that live in the city. And we have different funding streams to help people in rural areas versus in the cities. So we get out there, we talk to people. This year we have 6 wildfire workshops that we are conducting in our rural libraries. We just had one of those last night. And we will be giving away box fan and filters at those. At the health department, so when I'm not out in community, some things that I work on are our climate and health cross-divisional team. This is a group of professionals across the health department, whether they work in admin or communicable disease or environmental health, that have an interest in climate and health change, climate and health issues. And we meet monthly and we talk about different topics that are coming up in climate and health. So it's a way for us to build our organizational capacity around knowledge of climate and health. And it also allows us to invite in people from the community to share with us things they know about climate and health. So next month, we're going to have a visitor from the Puyallup Tribe of Indians, and she is going to share with us about indigenous foodways and traditional ecological knowledge. That's just an example. Every month it's something different, but we're always trying to learn and get better at what we do. I would say the thing I'm most proud of is bringing the public health voice to many different tables. It's really, I'm the first person in the state of Washington to have the word climate in my title for a local health jurisdiction. So the work is very new. And there's a lot of folks who don't know that public health departments do this kind of work. So luckily, with my background and my connections through Conservation District and other boards that I've served on, I do have a large network, and that network gives me the opportunity to bring public health to a lot of different meetings and conversations where it wasn't happening before. So I'm very proud of that. I'm also very proud of the fact that since my arrival, we have translated most of our infographics around climate and health into 9 different languages. So those are available on our website at all times. People can learn about extreme heat in any language that they need to, as long as it's the 9, which is pretty many. We've got Russian, Ukrainian, many different languages. So I'm also very proud of that. And the thing I want to say here at the end is that my work is driven by my relationship with NEHA. When I started in this role 3 years ago, I was involved in a NEHA CHAMP grant. So CHAMP, the CHAMP program is the Climate and Health Adaptation and Mitigation Program. I would not know how to do this work if it was not for the CHAMP program. So big thanks to NEHA for leading me in that direction. Also big thanks to NEHA for providing me with 2 amazing NEPIP interns the last couple summers. I would not be able to do the work that I do without the help of those interns. And I'm also excited because NEHA's provided me the opportunity to share about our work, which is very new, on the national stage. I've presented at 3 different NEHA AECs, and I'm just really grateful for everything NEHA has done for me as a new to the profession person. Back to you, Nicole.
Thank you so much, Cindy. Quite amazing. Wow. We do have a couple questions for all of you from our audience. I believe this first question goes to you, Casey. Beck is asking, what Indigenous knowledge or practices have you noticed that coexist with non-Indigenous communities and policies?
Yeah, and I think for us, it's really that concept of two-eyed seeing, which I think was a Canadian Indigenous kind of ideology from the Mi'kmaq and Elder Mi'kmaq Nation. But it's really that seeing both the Indigenous ways of knowing and the Western ways of knowing or science as equal and both necessary to advancing the work. So I think I'd like to highlight kind of the holistic, and we use holistic with a W, way of perceiving human health, where it's not just the absence of illness, but it really is about the health of the land, about the health of relationships, about the health of communities, and advancing that over multiple generations. So I think that's kind of another takeaway, is that holistic perspective, and then looking, that 7 generations in the future, which I think is a kind of common concept amongst Indigenous populations, is not just for, the now and for the current population or for your kids or your grandkids. It's really, how are we maintaining that land for 7 generations, and recognizing that the choices that we make and the balances that we have between economic development and human health aren't just short-term, they're very long-term considerations. And I'll share kind of the visual First Nations perspective on wellness that underscores our work into the chat as well. I love Maddie's idea of sharing links. So I'll share a link to that, which does a much better graphical representation job of presenting that than I'm doing verbally.
Thank you, Casey. The next question is from Samantha, and I'm thinking that each of you might want to chime in on this, but I'll start out with Maddie. What do you think can be good ways to get into environmental careers if you have limited experience?
Absolutely. Happy to answer this. I would say, really speaking on your experience from your education or volunteering opportunities, I think in this post 2020 virtual world that we really have shifted to, there's a lot of opportunities on LinkedIn and upskilling and webinars like this that you can capture and speak on in your resumes and your interviews and things like that. But really starting to network in even those virtual and in-person spaces to build those connections and starting to get your feet wet in what you would like to do in environmental health or in climate or in other areas of public health, because you might find that you like other areas of public health. And I think Natasha had talked about that earlier, about how, you know, in environmental health and climate, you can come from many different areas with many different backgrounds and expertise. So I would say lean on the virtual resources at your fingertips. Speak highly about your experience. You are very capable of many things. I think sometimes as public health professionals, we may downplay, but you can do anything, and continue to expand that network virtually and in person. And I think even Cindy talked about a couple local opportunities. So things like that, I think, are great places to start.
Thank you, Maddie. So you led the way. Cindy, do you want to add to that?
I would love to. I would say that part of the reason I have this job is that I did have a good network. I was invited to join a few boards while I was still in my master's degree program, and joining boards was a huge help in me finding a job. The other thing to think about is to have a good story. So practice your interview questions. Think of ways to creatively answer those questions that you're asked. And my story about being a young mom is really the reason I got this job. My supervisor also used to teach moms about environmental issues, and she really clicked with me when I talked about that. So think about the experiences you've had in your life, which might be interesting or unique or creative, and share those with your hiring manager. You never know what's going to land with people. So be ready with lots of good stories.
Thank you, Cindy. Dr. DeJarnett?
Oh, I appreciate this question so much. And as I'm thinking through the response I have to it, I think it's actually my response to a lot of things. Volunteer. So where you can, if you're not able to jump directly into a paid position, there are plenty of groups that would benefit from the expertise that you can offer, and there's so much that you'll learn within those groups, maybe even more that you'll learn from the group. And so, for example, for me, this isn't a climate change example, it certainly borders on it. I had completed my PhD and was trying to figure out where to go next. And I really wanted to get involved in environmental justice. And I was not finding a natural path. And I started volunteering locally with one of our local environmental justice organizations. I still today call on the knowledge that I learned from that very formative time of working with this organization. So I've joined many professional societies, and I think that also opened a lot of doors for me. And I say this as someone who doesn't love networking in the traditional sense, but there are ways that you can network in a way that is comfortable for you, that will work really well for you. So volunteering, getting involved locally, also getting involved in professional societies like NEHA. What you're doing right now is certainly a really good step in that direction. And definitely echo the things that Maddie and Cindy have shared.
Thank you, Dr. DeJarnett. And Casey, did you want to chime in on that?
I think I'll just further underscore that connection to volunteering and to the other, I'll call them extracurricular type of pieces. And I think my learning has been that your 9 to 5, your day job doesn't define who you are or what you're interested in. And if you can find linkages to what you're doing, fantastic. And I'm privileged that I have the opportunity to do so, but have also found so much more connection in that volunteering, in the boards, in these types of NEHA committees that we get to be a part of. And then once that creates your network, it branches out from there. So I'm with Dr. DeJarnett. I don't love being extroverted and networking, but you get these kind of small end networking opportunities to meet folks, and that really expands your opportunities.
Awesome, thank you. And let's see, Casey, I'm going to address you again from Rianita. In your work with your local municipality, can you share any interventions that have been planned or implemented to increase resiliency in your communities, especially with the heat waves that you experience?
Yeah, absolutely. And so I think kind of the first one I'll speak to is actually piggybacking off of something Cindy had mentioned, which was the distribution of the box fan filters. And so we know that, fans only have cooling potential up to a certain temperature and humidity, but for our climate, they're fairly effective, except for some of the worst of the climate events, and can also provide that protection from wildfire smoke as well. So we've actually led, in partnership with Simon Fraser University, a research institute here in the province, some DIY air cleaner workshops where you get community members to come together for a couple of hours. They get to build their own DIY air cleaner with the box fan and MERV 13 plus filters, but they also get a couple of hours of knowledge translation from, I'm going to say, professionals. So it's either the research group or our environmental health teams, to have some of that dialogue about the impacts of both heat and wildfire smoke. In our province, starting after our 2021 heat dome, which was kind of the hottest part of the Pacific Northwest, but also the deadliest climate emergency in our province's history, our local power authority, so BC Hydro, which provides electricity to most of the province, actually enacted and still has a distribution program for portable air conditioners for people who are most sensitive or vulnerable to extreme heat. So people who have schizophrenia or elders or other vulnerabilities to heat. Central air conditioning isn't really a big thing, especially in places like Vancouver, where it's usually temperate. So when you get these 100+ degree days, people are neither physically able to tolerate that, they're not acclimatized to that, nor is the infrastructure able to stand up with that. And then I think the other thing is that both with the communities we work with and municipalities, there's a lot of intentional work put into extreme heat planning for communities. And so developing heat resiliency plans, which talk about things like checking in on elders, making sure people have access to their medication, really creating those like phone trees for peer-to-peer supports for folks. Communities will typically open up cleaner air spaces or cooling shelters when the days kind of get really hot. And then provincially, we've developed a heat committee. Heat is actually an acronym for health effects of anomalous temperatures, because it gets really cold here too, but again, primarily focused on heat, where it brings together health system leaders to create policy advocacy in that space. So we can create things like funding and tax incentives. And part of that has been enabling our province, or equivalent to the state government, to fund municipalities to open up these spaces. So we've actually recognized extreme temperature events as a regulated emergency, in the sense that municipalities can get some money back when they do some of these interventions, which of course is a good way to get people to do things.
Good, thank you, Casey. The next question is coming from Denise, and I see this as probably a concern that a lot of people have, Denise. Can you address how you do climate for health work in spaces where talking about climate change doesn't feel so safe nowadays? I imagine this is probably very challenging for all of you. So whatever recommendations or thoughts you have on that. Whoever would like to speak. Cindy?
I can share a little bit. I do a lot of my work in the rural parts of our county. And these are places where it is less likely that people will accept the idea of climate change or be willing to talk about it. But one thing we've discovered is that they can't argue with the facts that these things are happening. So there are more wildfires where they live. There are extreme heat events that haven't occurred before. Whether these are caused by climate change or not, it's our job to prepare these communities to adapt to these changing conditions. So that's what we do. We may not use the word climate, but we will use the words extreme temperatures, and we will talk about wildfires. And if we just keep it at that level, we don't get a lot of argument.
Thank you, Cindy, for addressing that. I lost a little track of time here, so I'm so sorry that I have to cut off on that question. I hope that was helpful, Denise. So I'm going to pull up my screen. We'll be done here in like 2 minutes. Let's see.
And I can go ahead and start talking as you pull that up, Nicole.
Sure.
I just want to, first of all, thank you so much to all of our panelists and speakers today. It's been so great to hear from you, and we really appreciate your perspectives and your stories. So my name is Adrienne Gothard. I'm a program analyst here at NEHA, and my role is really to support NEHA's student and early career development initiatives. So NEHA has always had a focus on supporting the development of environmental and public health students who are planning to enter our workforce. As we really know that, an estimated 40% of the environmental public health workforce today plans to leave their job in the next few years. So our focus on student includes academic scholarships for graduate and undergraduate students, and we gave out more than $18,000 last year. We do a student research competition. Of course, our environmental public health campus grand rounds like today, where students get the opportunity to engage directly with experts in the field. And you can find the recordings of our previous campus grand rounds on our webpage. We've got mentorship opportunities and access to our community of over 7,500 members. And then a lot of additional career building and professional development resources. We're also super excited right now to be offering a free 12-month NEHA membership for students if you join by October 1st of 2025. If you have any questions or anything, any ideas for students, please reach out to me. I'll drop my information in the chat here, and you can visit our student webpage to find more information. So thank you.
Thank you, Adrienne. So we would like to give a big thank you to our guest speaker, Dr. Natasha DeJarnett, and our guest panelists, Madelyn Gustafson, Casey Neathway, and Cindy Haverkamp. And thank you to all of you for joining us today. I hope you gained new insight into the field of climate change. We have one final request of you, and that is for you to just take a few minutes to provide your feedback on today's seminar by completing our evaluation survey, which you'll receive the link to shortly. Your feedback will be so valued and assist us in being better able to meet your needs. It would be greatly appreciated. Thank you so much again. Wishing you all a wonderful rest of your day. Goodbye.